Hi everybody, it's been a while. So welcome again to Dr. Manny's YouTube Learn-shops, and we'll start from the beginning when we look at acute care. So this presentation, although short, will just review the process for evaluating disease and disorders. So first of all, this is the list that we should follow. And this is just an example, and I've chosen cardiogenic shock as a consequence of now the disease and the process that will follow. So there should always be a definition. There should always be an etiology, a cause, which can be related to the pathophysiology. There should be some way of doing an assessment or a diagnostic evaluation. And we should always be looking at management, whether that be medical, nursing, pharmacological, or otherwise. And we should be looking at the complications and the prognosis, and if there's a potential for rehabilitation. Now, again, I'll use the example cardiogenic shock. The definition, and we're not reviewing cardiogenic shock, we're just reviewing the process. So cardiogenic shock is essentially a life-threatening condition in which your heart suddenly can't pump enough blood to meet your body's requirements. Metabolic needs. The condition that most often causes cardiogenic shock is typically a severe heart attack, or better terminology would be myocardial infarction. When we look at the etiology, I already said the most common cause of cardiogenic shock is a myocardial infarction, but other conditions can also lead to cardiogenic shock, such as heart failure, chest injuries, the side effects or adverse reactions to certain medications, and conditions that prevent the blood from flowing freely through your heart, such for example as a pulmonary embolism. What then is the pathophysiology? Again, repetitively, myocardial infarction. And this is a medical emergency. And atherosclerosis is usually the cause, a blockage, an obstruction in the coronary arteries, the arteries which supply blood to the heart. And this can result in sudden cardiac death or a myocardial infarction that the patient may survive. What about diagnostic evaluation? Well, the diagnostic evaluation are your vital signs. To begin with, you can be doing things like an echocardiogram, an electrocardiogram, a chest x-ray, cardiac markers like troponin I or T, CKMB, myoglobin, and the definitive one would probably be cardiac catheterization, a coronary angiogram. What are other assessment findings that you might want to implement? Well, again, level of consciousness would be important. Maybe implement the Glasgow Coma Scale. Vital signs, pulse, respirations, blood pressure, SpO2, chest pain. Pulses might be faint and irregular. If they're having things like premature ventricular contractions or other runs of now potentially life-threatening dysrhythmias like ventricular tachycardia. Of course, there'll be signs of decreased tissue perfusion, cold, pale, clammy skin, and in the worst scenario, possibly mottled extremities and cyanosis. If they've got congestive heart failure, which includes right heart failure, then they'll probably have jugular venous distension. What's the management of cardiogenic shock? Well, that depends. It depends on what is diagnosed. So if it's suspected, this algorithm isn't too bad. For non-acute coronary syndromes, the guidelines will follow whatever is directed by the medical interventions. If it's confirmed coronary syndrome, then they may require hemodynamic support, whether that be vasopressors and positive inotropes, oxygenation and mechanical ventilation, maybe even an IABP, intra-aortic balloon pump, other vascular assist devices, even in the worst scenario here, ECMO, extracorporeal membrane oxygenation, VA. And if it is confirmed it's an acute coronary syndrome, they may possibly go onto a platelet inhibitor, maybe anticoagulation, possibly here now decreasing cholesterol levels with statins, and so forth. What's the nursing management? Well, the nursing management typically would be supportive and follow the prescriptions that the medical interventions recommend. And this could be administering oxygen, establishing IV access, restoring fluid volume cautiously in cardiogenic shock, vasoactive medications according to orders. And again, the nursing assessment essentially considers vital signs. But always remember your ABCD, airway, breathing, circulation, and disability, which probably relates maybe to the neurogenic component. What are some of the complications of the cardiogenic shock? Well, death, absolutely. Cardiopulmonary arrest, certain dysrhythmias like ventricular tachycardia, ventricular fibrillation, as a result of hypoperfusion, renal failure, as a result of hypoperfusion, certainly multi-system organ failure. And look, as a consequence of the weakness created by the ischemia and the infarction, possibly now a left ventricular or a right and left ventricular septal aneurysm, maybe certain thromboembolic sequelae, which can result in stroke and ultimately affect every single part of the body. What's the prognosis for cardiogenic shock? Well, there's a pretty high mortality. So a mortality exceeding up to 70 to 90%. But the risk factors go up if you have comorbidities, and age certainly is a factor. Rehabilitation? Well, rehabilitation is a possibility if the heart recovers, and typically you may go into an exercise-based cardiac rehabilitation program, and certainly things like diet control, medication compliance would certainly be a factor in rehabilitation process. Okay, let's review. Remember the sequential delivery of data when reviewing the process for diseases and disorders. And here they are. Have a definition of whatever the disorder is. Know the cause, the etiology, which can result in the pathophysiology. How do you assess or diagnose it? What are your assessment tools? And typically, for us as nurses, they will be vital signs, being most important. Management can be medical, pharmacological, nursing. It can be medical or it can be surgical. What are the complications of this disorder? Because that may lead into the prognosis and the outcome. The prognosis, how well are they going to do? And are they able to be rehabilitated? That's the process that should be followed when you are reviewing diseases and disorders. Okay, thanks. That was short and sweet. And look, as I've indicated previously, if you think that these Learn-shops are of any benefit to you, please subscribe. And really the subscribing is, just to make sure that you have access to future Learn-shops. Take care and God bless.